Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to ITV's Medicine of the Prophet, your guide to healthy living. I'm your host, Farooq Hussain. This is episode 17 of 20 episodes, and we're focusing on the topic of medication. In this episode, we'll be discussing the history and the development of medication, both herbal and conventional, as well as how these medicines are classified and their mode of action. We'll also be looking at how we prescribe this medicine and the safety of both herbal and conventional medicine. This episode then will raise the following questions. How does TB medication address both symptoms and causes of illness conditions? And how might TB medication, together with conventional medication, be used as part of an integrative treatment? To discuss this topic, I'm very pleased to be joined in the studio with our evergreen stalwart, Professor Rashid Bhika, and our guest, Dr. John Glynn. This segment will then be focusing on the introduction and the history and the development of medication, both herbal and conventional. We'll also be examining the discovery of the indications based on the temperament of people and the medication that they will be using. Allow me then to bring in Dr. John Glynn first, and to begin by asking Dr. John Glynn, welcome first of all. And the history and the development of a medication must have spanned over thousands of years. Can you talk us through, albeit briefly, the history of herbal medication?
You know, Farooq, herbal medication is probably the oldest form of treatment. It goes back way past the ancient Greeks, even past the ancient Egyptians. Now, for a long time, it was not highly regarded, and even Hippocrates said that let food be your medicine and medicine be your food.
So he was ahead of his time, because these days we use tablets as our medicine and as our food.
Indeed, yeah. He did accept that herbs had a part to play in certain conditions. Now, major progress was made at the time of Galen. He accepted that different medications, medications, worked in different ways and had different potencies.
So when did Galen appear on the scene?
I beg your pardon?
Where did Galen appear on the scene?
Galen appeared about in the later stages of the Roman Empire. And he was, for then there was a little bit of a hiatus between people who developed the herbal story. The next was Ibn Sina, also known as Avicenna in the West, who formulated studies on different drugs available to him at the time.
But at this time it's becoming more scientific and not just anecdotal.
Indeed, he was now moving away from superstition and magic and so on into the more scientific time. Some progress was made, but the next really big step was in Western Europe at the time of Culpeper, who had the temerity to translate a lot of information on the herbs into English, which was the prevailing lingua franca at the time, much to the consternation of the medical profession. This carried on, the herbalist societies got organised in the period following, and true to form, there were certain schisms and divisions with them, and but this now sort of merged in with the industrial age. Before this, the awareness of herbal medication was becoming more dominant, and the active principles involved in the treatment were beginning to be being isolated and refined and so on. Now, at this also time, there was a divergence in the use of herbals. Individual herbs were isolated or the active components were isolated and purified on one side, and the new industrial age was bringing through chemical synthesis of what are called new to nature products. Even so, even today, there are something like 25 major drugs which are based purely on herbal sources.
It's astonishing.
It's a huge number of drugs, even now. Now, of course, we have a massive industry, probably one of the dominant ones in the world, dealing with the herbal products and applying them to a whole range of real and sometimes imagined conditions.
So the strength of our Tib al-Nabawi is that we obviously have a more spiritual approach as well as a scientific approach, and also looking at the pharmacological effect that it has, and understanding your own temperament as well.
Yes, indeed.
Wonderful.
Yes.
Thank you, Dr. John Glynn. Let me turn to Professor Rashid Bhika and ask Prof. Prof, over the centuries, sir, there have been thousands of natural medicinal substances with many different indications for which they are used. Where did all this information come from? Was it purely anecdotal? Was it housewives' tales? Or was it based on true scientific basis?
Jazakallah khair. Bismillahir-Rahmanir-Rahim. This, to answer the question, I want to just talk about the discovery of aspirin. We all know aspirin originated from the willow, from the bark of the willow tree. Now take this particular active ingredient, after it was isolated and discovered, aspirin was used initially for its properties of being an analgesic and an antipyretic. In other words, for pain and fever. But over the last 70 to 80 years, we found additional benefits of aspirin with all the technology that we have in the last 25, 30 years. So this means that one active ingredient from a plant, if you talk about scientific rigor to find what the pharmacological action will be, it took 50 or 60 years to discover that aspirin is not only for pain and fever, but also can be used as a blood thinner and of course quite extensively used in coronary heart conditions. So the message I'm trying to bring about is that with all the technology, it took us 50 years of research to find an additional indication. All right. Now, this brings me to the point that over the centuries, there are more than 15,000, 20,000 herbal products or natural products. Take, for example, garlic. We know that garlic is used for so many different things, for hypertension, for diabetes, for increasing metabolism, etc. There's about 10 or 15 different indications as far as garlic is concerned. Now, if there are more than about 15 or 20,000 herbal or natural substances, and all of them have got about 5 or 10 different indications, where did all this information come from? And this brings us to the realization that this information could only have come from either revelation or inspiration. Okay. In fact, let me just read to you some of the quotes from Tib al-Nabawi. Traditionally, Seth, the son of Adam alayhi salam, was the first to make knowledge of medicine known. Idris alayhi salam evolved the science of philosophy and medicine. More likely that knowledge of medicine was revealed by Allah subhanahu wa ta'ala to his people. This much is certain, that guesswork and experience alone are not sufficient. Let me just read another little saying. And we have been told from authentic hadith that Sulaiman alayhi salam acquired knowledge of plants which grew in front of him, and when they grew, he asked the plants, "What is your name? What are you for?" And he then cultivated it and recorded it. So this highlights the fact that this knowledge is ultimately God-given.
Wonderful. Thank you, Jazakallah, for that, Prof. We'll be going for an ad break now, and still to come. In the next segment, we'll be looking at different classification in medication, both conventional and prophetic medicine, with respect to their pharmacological action. We'll continue this discussion, folks, after the break. Be with us. See you after the break. Welcome back, and thank you for staying with us. If you've just joined us, you're with ITV's Medicine of the Prophet, your guide to healthy living. And with me in the studio is Professor Rashid Bhika and Dr. John Glynn. just to remind you that we're looking at medication, its uses and value. Now, in this segment, segment 2, we'll be looking at the different classification of medication in conventional and prophetic medicine. We'll also be looking at their pharmacological action. And we will have for you a short clip, external clip, providing info on the trend towards the use of herbal medicines. Now, the trend towards using herbal medicine is currently on the increase. And I should like to draw in Professor Rashid Bhika now and ask, Prof, currently, sir, we are aware that many medicines can be bought over the counter, in particular herbal medicines. Now, is there a link to the scheduling of medicine? And what is the classification of this medication according to TEEP?
Certainly, Farooq. I think most of us consumers are fully aware that we cannot just buy anything out of the pharmacy. We are aware that the current medication have got certain schedules. In other words, from Schedule 0, which is over-the-counter medication, and person doesn't need, there is no control over that.
Right.
And then it goes up to from Schedule 1 to 2, right, which is something a pharmacist can give, from a pharmacy without a doctor's prescription. Right. Then you go from Schedule 3 onward, 3, 4, up to 7. Again, so this whole scheduling system depends on the potency and the toxicity of the medication. In other words, something which is relatively very, very safe. Again, within the understanding of safety,
right,
and of course the toxicity or the potency of the medication from Schedule 0 up to Schedule 7. Now, historically, one might even get the impression or think that maybe in the old days there was no real control in how medication were actually classified. Now, from again, extract from Sayuti's Medicine of the Prophet. In those days, according to TIB medicine, medication is classified into 4 different categories. The first category, which is medication with no obvious effect, but food with medicinal properties, such as almonds, and most of the nutraceuticals fall in there. Then the second degree are some effect but not harmful. In other words, it's got a potency of medication, and what will fall in there is obviously ginger. The third degree is harmful substances but not fatal. Now here, a medication such as senna leaves, which has got a definite effect but is not fatal. And the fourth degree is poisonous or very toxic substances such as opium. So from Tib and Nabawi 2, or in Tib medicine, medicines were classified according to its safety, its potency, in terms of its pharmacological action.
Thank you, Prof, for that wonderful scholarly insight and extensive research you've done for us. Now, I'd like to draw in Dr. John Glynn. Dr. Glynn, is there a difference in the mode of action, in other words, how it works, between conventional medicine and natural herbal medicine? And perhaps later on in the program, you might want to talk about the effect that it might have, the herbal, on the conventional medicine.
Yes, good question, Farooq. The way the herbal medication works and the way that conventional medicine works is really based on our view of how the body works. Now, you remember that in conventional medicine, the body is seen as a very complex unit which occasionally either breaks down or needs a part replacing. And of course, this is what modern drugs do. They act upon the part of the body, in theory and ideally, to rectify the problem, and this restores health. The herbalist will approach illness by seeing the body as a complex organism where we have harmony between the person, the environment, and the physis of the lifestyle of the individual. So this is really the essence of the difference. The individual drugs, the pharmaceuticals, act on specific targets, whereas the herbal medication seems to act to restore harmony within the diseased body. That isn't to say that the drugs, that the herbal medication don't have active ingredients. They do. And I mean, modern medicine has benefited so much from deriving actives from natural sources like plants and to some extent fungi to derive very effective, very specific and, let's admit it, very profitable formulations of drugs.
Thank you very much, Dr. John Glynn, for that exposition. We have a short clip for you on the clamour towards the use of herbal medication. And the external footage captures the view of Dr. Grant Neeland on the reasons for the move towards the use of herbal medicine.
There has been a switch in the consumer's mind to using more natural medicine, also known as herbal or complementary medicines. This has been happening gradually over a number of years, and the main reasons for this is that the consumer is wanting to take charge of his own health. People are tired of being instructed on what to do, not given the opportunity to actually listen or make their own decisions. They rather just have to listen to the doctor and take his word for what it is. So the switch comes along with that desire to take charge of things is also the fact that complementary or natural medicines are seen as generally having fewer side effects, or there's a lesser risk of a side effect than is often noted with conventional medicine. Now, as a consumer, most people have families, concerns to take care of, be it elderly parents rather or grandparents, as well as children. They also need to make sure that funds last, and orthodox or conventional medicine is expensive. And even though medical aids are there to assist, many people find they're running out of funds mid-year, and natural or complementary medicines give them the opportunity to make informed decisions and choices in choosing the kind of healthcare that they would like to use for their entire family. Complementary or natural medicines also offer a consumer the option to add on to a prescription. There's a whole host of medications which are known as OTC or over-the-counter medications, which any consumer is able to make a decision, and most companies that market these sort of medicines are available online or over the telephone to assist people in guiding them to avoid any possible negative effects happening if they're adding these onto their prescription medicines. What the consumer is also finding by doing this is that they have a better resolution to the problem. The symptoms are not just treated, but often the cause of the problem is dealt with by the conventional medicine being assisted with complementary medicines. And yes, the switch will continue to happen, and more people are looking at the alternatives offered by complementary / natural or herbal medicines.
Dr. Grant Neeland, on the reasons for the move towards the use of herbal medicines. Moving on then, we'll be going for an ad break now, and we'll be, when we come back in the next segment, we'll be looking at advice from Tib al-Nabawi on the prescribing of medication. Do stay with us. Welcome back, and thank you for staying with us. If you've just joined us, you're watching ITV's Medicine of the Prophet, your guide to healthy living. I'm your host, Farouk Hussain, and with me in the studio is Professor Rashid Bhika and our guest, Dr. John Glynn. Just a reminder that we're discussing the administration of medication. And in this third segment, we're providing advice from a Tib al-Nabawi perspective on the prescribing of medication, as well as how to combine both Tib and conventional medication as part of an integrative treatment. And now I'd like to draw in Professor Rashid Bhika and ask Prof, over the past decade or so, a lot of research has been done to enable doctors to prescribe medication. Now tell me, sir, is there a scientific basis in Tib al-Nabawi with respect to the prescribing of medication?
Farooq, there's absolutely no doubt about it that the practice of herbal medicine, definitely from the initial stages over the centuries, really evolved to the aspect of making sure on the concept of quality, efficacy. You know, those aspects were really very much part and parcel or form the basis on which the whole delivery or advice on the taking of medication. For example, you know, it is well known that to rather use simple drugs instead of the more complex drugs, firstly. Secondly, another aspect is of the development from simple drugs to compound formulation, where the different ingredients were used in a formulation to ensure that it enhances the effectivity and also it assists in terms of the safety. Right. In other words, if a certain medication might have certain toxic side effects, then additional ingredients have been included into the formulation to minimize the possible side effects. So a lot of research and years of empirical knowledge has come into the formulation. Right. Then also we talk about the dosage of medication. Right. You know, it again advised rather start with a lower dose, you know, again protecting the patient to avoid possible side effects or obviously reactions. Right. And like this, so many aspects that today pharmaceutical companies or pharmacists would look at possible aspects of safety and efficacy. These were all well documented, well understood, and well implemented. But one last point I want to mention, and I found this quite interesting, is that Tibb Nabawi or Tibb medicine, one of the advices given is you should not give a patient medication unless and until you are sure of the diagnosis. Because so often, if you're not sure of the diagnosis, you don't know what your physis, inherent wisdom of the body, is attempting to overcome the problem. So very often, if you start giving medication without being sure what the condition is, you might well interfere with the normal process of healing.
So there's as much scientific rigor in Tibb al-Nabawi as there is in so-called conventional medicine.
Absolutely.
So most encouraging and most welcoming. Now, let me draw in Dr. John Glynn here. In an earlier clip, Dr. John Glynn, we saw that Dr. Grant Neeland mentioned the move towards the use of herbal medicine and the clamor towards its use. Is this an acceptable practice? I mean, is it safe? Because there's now questions being asked about, yes, it should be integrative, but, has it got an effect, the herbal medicine, on the more conventional medication?
Farouk, you know that there's two basic categories of disease. The acute emergency, things like pain control, severe infections, and so on. And those are probably today best treated by conventional medication, whether it's antibiotics, whether it's pain relievers. The other side is the chronic disease range, and this accounts for most of diseases which affect human beings. And those are traditionally, in many countries, been treated by natural medicine. Now, a recent development, which is very important, is the emergence of integrative medicine as an option, where the acute aspects of the disease are treated by conventional medicine, and the chronic aspects, the long-term recurring symptoms and so on, are treated by herbalism as part of complementary medicine, which it is. Now, this provides a lot of advantages. First of all, it treats the whole person, so you've got the advantages of both. In fact, it's called the best of both worlds. It also encourages inner healing, which conventional medicine either ignores or sometimes inhibits. And thirdly, it avoids this whole problem of the long-term use of conventional medication, where you have major problems with side effects and with long-term effects on the body's metabolism and performance. So integrative medicine seems to be a very popular way to go, which is gaining momentum in both developed countries and developing countries.
Wonderful. Since you're on a roll, Dr. John Glynn, any closing comments on this topic?
Well, as I mentioned, integrative medicine is a form of treatment which is user-friendly, it offers the best of both worlds, it's probably more cost-effective, it's certainly going to be better tolerated, and it opens accessibility factor. It means this type of medication is available to a lot more people than, say, conventional medication is outside the Western world.
So to use Professor Bhika's comments, that it should be integrative, as you suggest, but there's also a scientific basis to it all.
Oh, without a doubt.
Wonderful. Yeah. Any closing comments then, Professor Bhika, on this topic, sir?
Yes. I think just to highlight that herbal medicine or tib medicine has evolved over the many centuries. And yes, without a doubt, while it is safer, it has less side effects than conventional medicine. But one should not only focus on one should not have the understanding that it is entirely safe, because all medication which has a pharmacological action will have an effect. So while it is safer, it doesn't mean it is always absolutely safe.
Wonderful. Gentlemen, thank you very much for practicing and rehearsing the very first revelation of the Quran, which is read in the name of the Lord that has created you. There's a wonderful saying in the Quran that we should also do the act of gifting. And I have two gifts for both our researchers, Professor Bhika and Dr. John Glynn. I hope that you'll be able to plant these seeds and get the message and the metaphor in it that Allah is beauty and Allah loves beauty. And I hope they enjoy the beauty of the seeds and the plants that will come from here. And so in summary then, and in closing, what we try to do in this program is to look at medication in TEEB and how it works at both a pharmacological and temperamental level, and thereby the way in which it addresses the symptoms and the causes of illnesses. TEEB and conventional medicine can be combined as part of an integrative treatment, and the doctor's supervision is required in conditions such as hypertension and diabetes. And so in the next episode, folks, we'll discuss medical ethics from the perspective of Medicine of the Prophet, your guide to healthy living. This is your host, Farooq Hussain, wishing you well. Until the next time we meet, Assalamu alaikum wa rahmatullahi wa barakatuh.